contagious viral disease which affects almost all the age group of this pig swine population, and mostly characterized by very rapid and sudden onsets of fever, glowing of the eyes, button ulcers in the intestines, congestion and hemorrhages in many of the visceral organs. Okay, and it used to show in two distinct syndromes. That means it may be in the form of very acute infection or a chronic persistent infection. So while in case of this, I mean acute infections, mostly the infection used to be acquired postnatally, means I mean after the birth. Okay, and where means there will be high morbidity and mortality with generalized hemorrhages in many parts of the body of our vision organs. Severe, I mean these hemorrhagic lesions, generalized. Okay, with high morbidity and mortality used to be there, and that used to get this infection after birth. Then, as in case of this chronic persistent infection, which used to get acquired prenatally. Okay, and here means there used to be, I mean, what to say, this infection during the this your fetal life, and there used to be low mortality so far in case of this mature pigs, where the mature pigs and the, I mean this pregnant sows, they may show abortion and stillbirth of the these animals. I mean they may show stillbirth. That is very common. Okay, and this one, this particular chronic persistent infection, where reproductive failures are the main sign and symptom. Okay, that is the main problem of, I mean, these chronic persistent infections. So this is more similar as in case of this your PRRS as well as your porcine circovirus infection. So far African swine fever is concerned, of course, that is more or less similar as classical swine fever. It is very much difficult to differentiate African swine fever from classical swine fever only by your these techniques like PCR, RT-PCR, molecular techniques by detection of the viral genome only means you can understand. Otherwise, from the signs and symptoms, lesion, and it is really difficult to differentiate. Okay, when we are talking about the natural host, true natural host about this classical swine fever, so mostly these are the domestic pigs. Just a minute, some are again waiting, I think. So these are the wild boars. I mean, these wild boars, when we are talking about, I mean, they used to preserve, they used to conserve this virus. Okay, and the domestic pigs, they are also the natural host. They used to carry the this virus, the infected one. Okay, and when we are talking about the this etiology, it is caused by a virus known as pestivirus of the family Flaviviridae. Okay, and environmentally, I mean, this virus is very much stable. They may remain present in the tissues of the infected animal, where particularly the meat. I mean, then even in the cold temperature, like I mean, this in refrigerated meat or the frozen meats, they may remain present for months to years. They remain just viable, this kind of this virus. And so far this etiology in details and all this in their family, the morphological structure and all this, you will learn in details. Of course, I don't know, you may have learned in this virology or not. Okay, so far pathology means I will not go that much, I mean, these details. Then coming to history, I mean, I'll just skip it, this portion. You have to go through it. I mean, first reported of this disease in the year and this 1833. Then in the this recognition of the etiology and all these things, right? Then geographical distribution also, I will skip it. Please go through it. Then recent outbreaks and all these things, this also I'll go through it. And so far your economic impact is concerned, this is so far we have this learn. I mean, what is economic impact or economic importance of a disease, right? The loss maybe direct or indirect loss due to the disease occurrence. Whenever the disease occurrence used to be, or the outbreak used to be there. Okay, so here particularly, I mean, as I have already mentioned, is that high morbidity and mortality. So direct loss maybe due to this mortality. Then some other this so many these factors, the cost involvement, then the loss in the export import in the of the this peak and as well as the peak products, then the cost involvement for this preventive measure control, then your this vaccination and treatment and all these things, right? So this way it is also an economically important disease. Okay, then now one thing I would like to this mention is that last time I have mentioned in the Rinda page. Okay, when we talk about morbillivirus in disease Rinda page, we talk about something about the biological weapon. Okay, that means by using this organism, sometimes some country or some this they may utilize as a biological weapon for kind of war to other countries, right? So this classical swine fever virus or this disease also can be utilized as biological weapon. Okay, so how it can be the disease because of having high rates of morbidity, mortality, most commonly in the animal population with no immunity. Means in those swine population where they don't have any immunity against this virus. Okay, means NAP population. What I like to mean is that which have never been exposed to this infection. Okay, then number 2 point is intensification in the swine industry, including the large number of animals per site and increased movement and distance between the sources, increase the possibility of the widespread dispersion of the disease. That means being a highly contagious disease. Okay, whenever it used to be introduced in a country or this wine industry entirely, means it may be killed. Because of the rapid this spreading out of this disease within this population. So if you utilize this virus and they spread out in a country or where the big population, big industries are too much, this what to say, high demanded, and the products are also like population is also so high and all, then the almost entire population, the big population will be killed and the swine industry will be disturbed. Then why, as I have already mentioned last time, that the objective of a war is not only killing the people by using lethal weapons and all, right? So the this economy and of the country, national economy, that should be affected, then people will suffer. So this way, that is also one kind of this objective of the war. Then the economic impact, when I was talking about highly and this important due to the this mortality, high mortality. Okay, so whenever means this disease is introduced in the production system and in the swine industry, so it will give a great impact, economic impact. That means great loss due to high mortality of this disease. Okay, so automatically the country will this face a very much difficult situation and the trouble in particularly the national economy, right? So this way means this virus can be, or disease can be utilized as a biological weapon, right? Then morbidity and mortality. When we are talking about this morbidity and mortality, so there is little bit variation according to the age as well as the immunity status of the animal. That means there is to be higher mortality so far the young animals are concerned. It doesn't mean that only the young animals are affected. All age group can be affected, but high mortality used to be more in young animals, young piglets. Okay, then there may be variation of this morbidity and mortality according to the viral strain also. When we are talking about the forms of the disease, like acute form of this disease, classical swine fever, where this highly pathogenic, this strain of the virus used to be involved, leading to or causing high mortality, even up to 10%. Then Subacute means mild form, where it is not that much severe and this pathogenic effect, and mild strain will be there, with lower morbidity as well as mortality rates. Then, when we are talking about chronic persistent infection, chronic one, here few animals affected, mostly those affected, this pregnant, this sows, okay, adults, and whenever they are affected, few animals only, but almost fatal. Whenever this affected, it used to be highly fatal. And moreover, the problem is that so far the about the, this abo- I mean these pregnant sows are concerned, a great loss, economic loss due to the reproductive failures like abortion and stillbirth. That is very much this important. Okay. While some cases may remain as asymptomatic without showing much typical classical signs and symptoms of this disease. Okay, then it's coming to the transmission, animal transmission. Being a highly contagious disease, the virus used to remain present in the blood, saliva, urine, and feces, as well as in the tissues of the infected pigs. So when these type of these sources, infectious sources, the sources of this infection, body fluids and the secretion, excretion, and body tissues, and in this body and these tissues and all. So transmission may be through ingestion of the contaminated garbage and meat products, or direct contact of the fomites, or less commonly, of course, through aerosols, sometimes through semen of the, this breeding board, for example, if you are using the breeding board, which is an infected one. So the semen collected from that breeding board can remain as the infected source. Then, when it is inseminated, or the board and the breeding board is utilized for natural service, okay, mating, then it may just transmit the disease. Or sometimes there may be involvement of vectors, but this is not that much important. And all the infected pigs with this pestivirus, they are the only reservoir. Okay, like domestic pigs as well as your, what is that, wild boars. Okay, then coming to pathogenesis means the developmental process of this disease, classical swine fever. Entering through the nasopharynx means through oronasal, that means through ingestion or inhalation, maybe through aerosol or through ingestion. So the virus gain entry through this route, oronasal, then they will start multiplication. The primary multiplication of the virus starts in the tonsils. From there, they will get into the circulation. Then they will produce viremia, means presence of this virus in the circulation, that used to be within 24 hours of the infection. After that, means they will spread out to different tissues and organs of the body, leading to severe destruction of the endothelial cells, macrophages, and epithelial cells. Mostly, when they are, going into the circulation, the vessels, the blood vessels, okay, there means severe destruction of the endothelial cells as well as the macrophages used to be there. And when they reach and they are supplying blood to those, these different organs, right? So wherever means the epithelial cells of those organs also used to be destructed, and they used to cause hydropic degeneration and proliferation of vascular endothelium. Okay, mostly in the vessels, means hydropic degenerative changes with proliferation of the vascular endothelium. So because of that, they may cause occlusion of the blood vessel due to formation of thrombus. Means thrombosis is very common in those vessels. And when they are affecting those blood cells and all, mostly the WBC. Okay, so when in the initial stage they used to destruct many of the this white blood cells, WBCs, leading to leukopenia. Reduction in the number of WBC total, this WBC count, but it will be followed by leukocytosis. That means initially decrease in number followed by increased number of these WBCs. Okay, then Coming to the clinical signs and symptoms, so it affects almost all this age group of the pigs, right? And the incubation period may be varied from 2 to 14 days, and disease may remain variable. The sign and symptoms, I mean, according to the forms. So far acutely fatal to, I mean, this asymptomatic, we have discussed about acute the infection, subacute, and chronic persistent, and asymptomatic. So that means very acutely highly fatal with fatality, I mean high fatality infection to the asymptomatic type of this infection, I mean this disease form will be there. And when we are talking about the persistent virus, this viremia, when the virus remain in the, I mean, the circulation of the infected pigs being a carrier, right? So in such cases, so the, I mean, when they become adults, like more or like, I mean, this pregnant sows and all these things, so they will go for, I'm transmitting the virus through the, I mean, this fetus. Okay, so congenitally infected pigs will be this produced, and then it's just kind of this carrier, I'm this pigs getting just carrying this virus in their circulation, being persistent viremic this phase and all, and they will go on seizing the virus for many months, right? Then so for the acute form, which is the most important one, and I mean high mortality used to be there in this form. So in this case, you will have the clinical signs of this very high, this fever. Then the pigs, mostly the young one, of course, it doesn't mean that only the young and growers. Sometimes the adults also maybe, but mostly the young and this grower pigs, piglets. Okay, so they will go on huddling. I mean, they will gather and this together in the corner of the and this sty or the house, right? Huddling together, overlapping type. Then they will show very much weakness. They will be anorexic, that means no appetite, and they will show conjunctivitis, diarrhea, staggering movement, and this imbalance type. I mean, while moving, walking, so staggering. I mean, that means this little bit imbalance type. I mean, trembling and such type of thing. Then goose stepping, just like a goose. I mean, how they used to step on the floor, right? So then cyanotic condition of the skin, body and surface and the skin, bluish discoloration as I am showing here, right? Some of the on this parts of the body, particularly subcutaneous on this body skin. Okay, so cyanotic, this body skin or the, I mean this part, different parts of the body, as well as skin hemorrhages, erythematous as well as hemorrhagic lesions, and high mortality, which is death. Okay, then these are some and this more photographs showing the conjunctivitis, one is leading to gluing of the eyes. I mean, thickness of the eyelid because of the and this lacrimation, which used to, I mean, the excretion, which or ocular secretion is very much sticky in this case. Then high mortality means used to be always in the young piglet, and the skin. I mean, the very typical and this form is that skin hyperemia. I mean, the severe congestion as well as hemorrhagic lesions on the, I mean, this skin. Okay, mostly the this behind the this ear, the tips of the ear, then under on this ventral portion of the body, then the armpit region. I mean, this the thigh and all of these things, right? So these are the places mostly you will find this skin hyperemic condition as well as, I mean, hemorrhagic lesions, and it may lead to or it may turn into cyanotic bluish discoloration later on, right? And these are some more and these pictures showing hyperemia and the body is this surface skin sheet. Then huddling together of the piglet, and this is another picture showing cyanotic condition, bluish discoloration of the body skin. Then this growers and a little bit, I mean, this adult, this pigs, they are showing very much depressed, right? Then some neurological signs also may be shown as in case of this acute form, nervous form. Okay, nervous signs. In that case, you will have that problem, this staggering movement, that means imbalance, and they cannot walk properly with very much weak hind legs, means particularly the hind legs, hind limbs used to be very much weak. Okay, then in coordination of movement will be there. I mean, this they cannot walk properly with imbalance and all these things. Like in coordination means it will be, I mean, it will not be coordinated, means it cannot support their body and all, it cannot walk in a normal this posture, okay, normal form. Then convulsions, okay, contraction and this convulsion and this fits type, that may also be there in nervous forms and in the neurological signs are concerned. Then coming to subacute and chronic form. So far the subacute is concerned, it is more or less similar to acute form, but the symptoms used to be very, I mean, this mild, means very less severe as compared to acute. And almost the peaks in this phase or in this form, they may survive from the infection. Then coming to the chronic persistent infection, chronic form, almost all the peaks, particularly here the adults, the boars and I mean the pregnant sows and all the adults, they are mostly showing the chronic persistent infection. And in this case, the pigs used to be very much anorexic and they don't have any this appetite. They are much depressed, showing this body this rise body temperature with diarrhea, and most commonly reproductive performance, very poor reproductive performance or reproductive failures like abortions, stillbirth, and deformities. That means the this piglet which is born alive, for example, if stillbirth is not there or abortion is not there, if it is born alive, even then the piglets will remain very much deformed. And there's so many deformities. Okay, they are not normal. And those piglets which are born alive, means which used to get infection during the, I mean, this fetal life inside the womb of the mother. Okay, so they will remain as persistently infected piglets. That means they will carry the virus in their body tissues and organ and circulation. And when they are growing up, they will again, that means this infected, persistently infected piglets, they will remain as a source of infection in the pig population, right? Then these are some this photograph showing reproductive failures of the this stillbirth, this abortion and mummification and all these things, right? So mummification, these details, I mean, I will discuss in the, I mean, this reproductive system in systemic pathology. Okay, I mean, the different pathological conditions. Abortion means before, I mean, this getting mature, full mature, and before giving birth, if the this fetus dies inside the womb, then that is abortion. If it is, I mean, expelled out of the body, I mean, from the reproductive system. Okay, but that is, I mean, this abortion before completion of the gestation period. But once it is completed the gestation period but died, it is born dead, okay, after completion, then it is known as stillbirth. Okay, so this way, then mummified means the aborted fetus, if it is not expelled out, for example, it remains within the womb inside the, I mean, this uterus of the this mother, then which is, which cannot be this expelled out, which cannot be coming out of the this uterus. Okay, then it will get, I mean, this absorb all the body soft tissues and all these things. Some, I mean, this skeletal as well as body tissue turning into brown, black, and this color, it will remain inside the womb. So that condition and is known as mummification or mummified fetus. Okay, as I'm showing here, the black brown color. In the previous one also like this. These are the these mummified fetuses. Then aborted fetuses like this. Then coming to post-mortem findings. I mean, when we talk about the, I mean, these dead carcasses, and if you conduct post-mortem examination, what kind of these gross lesions, post-mortem findings will be there. Okay, it will be very much variable. Okay, but most commonly hemorrhagic lesions on the skin, means externally when you this examine that, of course, means in the clinical science step, means we have already mentioned. Okay, then these hemorrhages, not only the skin and this and body surface and all these things. So many organs and tissues, many of the organs and tissues, because generalized type of this hemorrhages used to be there, is the virus used to be spread out through the circulation. So many of the this body parts, organs, and tissues will show hemorrhagic lesions because the virus used to destruct the vascular endothelium and causing destruction of these vessels. That means hemorrhagic lesions, hemorrhages will be there, and many parts, many organs and systems, right? So that is very common. Then, as we have already learned that in this pathogenesis, that the primary multiplication or replication of the virus occurs in the tonsil. So that's why the first lesion and the most common lesion in most of the cases of this classical swine fever, you will find necrotic lesions or necrotic foci in these tonsils. This is one tonsil. Okay, so here you will find this type of this necrotic foci or necrotic lesions. Okay, so this is very much common. Then coming to, the other organ and system and these tissues. So the hemorrhagic lesions, as I have already mentioned, generalized means how many these hemorrhagic lesions. So that may be of different type of this hemorrhagic lesion in the form of pinpoint means petechiae or ecchymosis on the serosal and mucosal layers of many organs like kidney, which is very commonly affected. Okay, when the kidney used to show this kind of this petechiae or petechial hemorrhages, pinpoint hemorrhages, if you see this picture, okay, these are so many. There are so many pinpoint petechiae here on the this renal capsule. This cortex. Okay, the kidney. So it gives a very typical appearance of an of turkey egg. Okay, I don't know. You might have seen the turkey egg or not. There are so many spots on the eggshell. Okay, so like this means this affected this kidney where you can see this petechiae or so many this petechial hemorrhagic lesions on the renal cortex. So giving this turkey egg appearance. So turkey egg kidney sometimes it used to be termed as. Okay, then the larynx, then the trachea, the intestines, spleen, and the lungs. So all, many of the organs and tissues, they will show hemorrhagic lesions, maybe petechiae or pinpoint hemorrhage or ecchymosis, little bit larger size. Okay, then these are some more. This picture of the petechial hemorrhages in the abdominal viscera. This the intestines and other organs. Then petechial hemorrhages, as in case of the larynx here, if you see here. Then these are hemorrhagic lymph nodes. The enlarged and this hemorrhagic of the lymph node. Okay, mesenteric lymph nodes and other inguinal and others lymph nodes. Then multiple infarcts. If you remember, infarct. Okay, that means what happened in case of the, this thrombosis of some blood vessels, right? So when there is blockage of the blood supply through sub-N arteries, okay, like in the at the margins of this spleen, for example, the blood vessels which are supplying blood to these parts of the this spleen, if they are showing some thrombosis, thrombus is there occluding the lumen of those vessels, then they will just deprive or they cannot supply blood in these regions. Okay, then they will go on this dying, these cells necrotic, this necrosis of these cells. Okay, so that's why they will go on this infarction. That is, infarction means due to the deprive of the this blood supply to this part, the cells used to die and go on necrotic lesions. Okay, those are what known as infarction or infarct lesions or infarcts. Okay, so multiple infarct lesions will be there at the margin of this, this spleen. So this multiple infarct of the spleen is another very important characteristic feature of acute form of this occurs classical swine fever. Then the one which we have already discussed, very important one is the necrotic, multiple necrotic foci or necrotic lesions on this tonsil, this area, this. Okay, so this is another this important this PM finding. Then the lungs will go on this congested, highly congested and hemorrhagic pneumonia is there. Then the colon is also showing this severe ulcerative and hemorrhagic lesions. The brain is showing severe congestion and other this widespread hemorrhages of the visceral, this surfaces of the this abdominal organs. Then another this picture same thing. The this hemorrhagic this infarct lesions there on the margin of the spleen. Then hemorrhagic and enlargement of the lymph nodes, and the typical this one is turkey egg kidney due to petechiae on the renal this cortex. And so far the intestines are concerned. Okay, very typical and this structure and this that is particularly in case of this chronic cases, not in acute. So some ulcerative lesions on the intestinal mucosa, particularly this cecocolic junction, the colon and the cecum and all. Okay, cecocolic junction, this is most commonly. Then other parts also maybe, but most commonly in this region, cecocol. And here, the ulcerative lesions used to be in such a way that very much, this typical shape of a button of your shirt, this the board and this the border used to be raised. I'll show you another picture, which is very much typical so far. See here. These are the button-shaped ulcers. Okay, so the board and this border is raised while the center is depressed and well demarcated from the surrounding area or tissue, and giving just like a shape of a button of your shirt. So that's why such type of these lesions are known as button ulcers. Okay, so that used to be present in the this intestinal mucosa. Okay, then there may be, this is very much common in case of chronic, as I was talking about. Okay, so just I have skipped something. So these button-shaped ulcers, then hemorrhagic lesions, and hemorrhagic lesions may be in the this tonsil as well as this on the heart also. Then the chronic lesion means chronic form mostly means as I am talking about the typical and this ulcerative lesions on the intestinal mucosa, particularly the cecocolic junction and all, and most commonly giving this typical button-shaped ulcers. Okay, as well as in addition to this, there may be a problem of epiglottis and laryngitis. Okay, and there is a most common thing. This problem is that as we have already discussed in this classical swine fever, is that congenital infection of the piglets when they are within the womb of the mother, means the infection through the mother, the fetus used to receive, and if it is born alive, for example, the piglet is born alive, but they will go showing some deformities as well as some, they will not remain as normal piglet, and they will carry the virus also. So in such cases, one kind of these lesions will be there in those piglets, congenitally infected piglets. There will be cerebellar hypoplasia, means the cerebellum will be hypoplastic condition. Then thymic atrophy will be there, thymus will be atrophied. Then there may be chances of ascites and many generalized type this hemorrhagic lesions and deformities of the head and leg. Okay, so this type of these lesions and the deformities will be there in those congenitally infected piglets which used to get the infection during the fetal life when they are within the womb of the mother, right? Then coming to microscopic changes. So far this brain lesion is concerned. When you make the section of the brain, okay, so what you will find is that wherever the blood, these sections are there, blood, these vessels and the sections. So just around the vessels, that means peri means around, vascular means vessels. Cuffing means aggregation of mononuclear lymphocytic cells like this. This is the lumen of the vessel. This is the vessel. So just around this aggregation or this presence of many lymphocytic cells, mononuclear cell lymphocytes. So this condition is known as perivascular coughing, and that used to be seen in case of the brain sections. Not only that, glial cells also used to be, this present, or this, this aggregation of these glial cells. So that is known as gliosis. Gliosis. Okay, and there may be intranuclear round homogeneous acidophilic inclusion bodies in the neurons. When you see the section of the neurons, the neuron and this nucleus, they may show presence of some this inclusion bodies. Okay, then there may be hemorrhagic these lesions, hemorrhages of the the vessels, as in case of this spleen, lymph nodes, as well as this kidney and many other organs and tissue. Wherever hemorrhage is there, if you make the section, then if you see under the microscope from those vessels, the vessel wall used to be destructed, and the leaking out of our extravasation of the RBC will be there. RBC will come out of the this vessel. Okay, then necrosis of the mucosa and the submucosa of the intestine, particularly when we are talking about the button ulcers and all these things, right? Then ulcerative lesions may also be present with infiltration of mononuclear cells, right? Then lastly, diagnosis. So clinically, the cases of this classical swine fever can be diagnosed based on the clinical signs and symptoms of a very septicemic condition of the disease, sudden onset of high rise of this body temperature, this purple discoloration or erythematous, or you can say cyanotic hyperemic condition of the body skin, as well as the tips of the ears, and as well as the history of the this disease, that is feeding uncooked and undercooked scrap and garbage, especially using the meat products, so it has been fed to the animals or not, that kind of history. Then addition of new arrivals, these new animals, new pigs to the herd is was there or not. Then recent international travel, then presence of the foreign visitors or workers into the farm complex premises, or lack of response by ill pigs to routine treatments. That means when you are going for routine treatment by using antibiotic or even this, but the pigs are not responding to that kind of this treatment because there is no specific treatment for the viral diseases, right? So they will not respond, and they would go on and just showing the clinical signs and symptoms and all, and the high morbidity as well as mortality used to be there. So these things are very much important so far clinical diagnosis is concerned. Then you can go for this confirmatory diagnosis by laboratory techniques for the detection of the virus or their antigens and nucleic acids. For that, this samples like tissue samples, tonsils, spleen, kidneys, distal ileum, the whole blood can be collected from the affected districts, and you can go for virus isolation in cell culture where PK15 can be done with immunofluorescent antibodies. Then antigen can be detected by using ELISA or direct immunofluorescence, and the nucleic acid can also be detected by using RT-PCR, right? Or some serological techniques like this ELISA or virus neutralization test, comparative neutralization test. So this way, you can go for this detection of the virus, their antigen and antibodies, or the nucleic acids. Then only you can give the confirmation that this is this very particular this phase virus causing this disease, classical swine fever, right? Then these are some pictures of the this direct this fluorescent antibody this technique or test for classical swine fever. Like this is a photograph. Okay. Then this is another photograph of this another technique for this detection of monoclonal this antibody evident biotin complex. Okay, by immunoperoxidase test for this disease. So this way it can be done. Then specimen collection, as I have already mentioned, means what sample to be collected. Then coming to differential diagnosis, what are the diseases having similar clinical signs and symptoms, or maybe in the lesions which need to be differentiated from this disease because of those similarities. Okay, so it is not, of course, not possible without any this laboratory technique for confirming whether it is CSF, PRRS, porcine circovirus, or some other diseases having similarities, right? So that's why confirmation by laboratory techniques always it is compulsory. So the diseases are porcine reproductive and respiratory syndrome, shortly in the short form PRRS, porcine circovirus associated diseases, that is known as PCV, I mean this porcine circovirus. Then salmonellosis, bacterial infection. Then another bacterial erysipelas. Then another bacterial infection, leptospirosis. Then I mean this another this viral disease, Ozelski's disease, commonly known as pseudo rabies, and the most common one, what we are facing now, and having much similarity, very much difficult to differentiate. Okay, that is African swine fever. Of course, this is caused by African swine fever virus. Okay, aspa, this of the asparviridae family. Okay, and from all these diseases, the disease should be differentiated. So let me give you some, I mean, clinical signs and symptoms, some just important features, the sign and symptoms. Little bit from this differentiating point can be noted down. That is, I mean, CSF and the differentiating from this PRRS, porcine reproductive and respiratory syndrome. Okay, so in case of this PRRS, okay, what we have talked about, I mean, cyanosis and erythematous or hemorrhagic congestion in different ways we have described of body, skin, and I mean this even the ear and all. So it was also there in the classical swine fever. But what the I mean this many researchers, I mean academicians also in many books also you will find that when it is of PRRS case, because of this much similarities in other and this lesion like this hemorrhagic lesion, congestion, or erythema, or anything. But in case of this PRRS, the ear used to be much swollen and edematous and more bluish in color. So that's why it is also known as ear edema or blue ear disease. Okay, so that used to be little bit differentiating point, but it is not easy, of course, to differentiate in this way. But so far the literature is concerned, it used to be more and more edematous, swollen, and more bluish in color in case of PRRS. Then others are more or less same. I'm just picking with splay leg. I mean, of course, this is not that much common in case of the, I mean, this CSF, of course. I mean, splitting out just like, I mean, the dog-like shitting. Okay, dog shitting and posture. Then these are some more on these pictures. Others are more or less same. I mean, with your this classical swine fever. Okay, so these are the different pictures. But only thing that one, what I was talking about, the severe bluish discoloration as well as I mean this swollen due to edema. So that is very much typical or more prominent in case of your PRRS. And respiratory system infection is also more severe, particularly of course in case of PRRS. Okay, and the only thing is that of course the etiology is different. It is caused by arterivirus. Okay, then the reproductive failures means please go through it. It is more or less same. I mean the picture I have just collected. Okay, and so far your this reproductive failures as in case of chronic persistent infection where reproductive performances, the performance used to be very much reduced and showing so many disease reproductive failures like abortion, stillbirth, then mummification and all these things. So this is also there in case of CSF as well as this PRRS, even as in case of circovirus associated diseases. Okay, but one thing means as far the literature is concerned, as in case of this PRRS. When you check, see the stillborn piglets, which is born dead, means stillborn this piglets. So there used to be highly edematous body skin, subcutaneous tissue like this. Okay, as I'm showing here, some of the piglets. So what we call, I mean, the generalized edema, or I mean, this almost all the body subcutaneous tissue used to show, I mean, this edema. That means anasarca, right? Generalized edema, giving glassy-like appearance, glass-like. I mean, this. Okay, so this is more prominent and more common in case of PRRS. So that is not much there as in case of CSF. So these are some of the differentiating points. So far, your this clinical sign and lesions are concerned, right? But it is not easy, as I have already mentioned that it is not easy from this. So that's why more by molecular technique, PCR, and this RT-PCR, sorry. So you have to go for confirmation by detection of the nucleic acid of these different viruses causing different diseases, PRRS or and this, and as well as your this PCB and this associated virus. Okay, diseases. So these are the these lesions of the lungs and some other organs, but lungs lesion used to be very much severe. Highly this hemorrhagic pneumonia used to be there, and a non-collapsible lungs. That means the lungs will not collapse when you open the thoracic cavity because of severe and this thickening and interstitium. The interalveolar septa used to be much thickened, so oxygen cannot get rid of the this lungs. It will remain as it is. Okay, so when you just open the carcass, the thoracic cavity, sorry, then it will not collapse. In normal condition, lungs used to collapse. Means air will get rid of the lungs. So lungs will in the collapsible collapse this condition. That will not happen. That will not be here in this case in PRRS. Okay, because of that severe hemorrhagic lesion and thickening of the interalveolar septum. That means the interstitium. So lungs will remain swollen and this edematous type little bit and with highly hemorrhagic. Okay, so this used to be there in here, and others are and this more or less and generalized hemorrhagic lesion of different organs and tissues. Okay, so these are some more pictures of this PRRS. See the severe the hemorrhagic lesion of the this lungs with non-collapsible type, then blue ear, right, and this ear edema. Okay, then others are more or less same. These hemorrhagic lesions on the these other organs like this heart and other things, right? So that's all for this disease. Your this classical swine fever and a little bit differentiating point from the PRRS, because PRRS it is not there in your syllabus. That's why I have just given some important features of that disease. Okay, because we need to differentiate from this. So by molecular technique means RT-PCR, by detecting the RT-PCR, sorry, the nucleic acid of the virus, as in case of the CSF pestis virus, then PRRS, your pestis virus, RT virus, then in case of this PCB, porcine circovirus, and this aspa virus, that is African swine fever virus in case of this African swine fever. This way you can give the confirmation and differentiating diagnosis with full confirmation. Otherwise, from the clinical signs, symptoms, and lesion, of course, it is not easy to give the differentiation. Okay, so that's all for this disease, classical swine fever, and that's all for today.